Thank you, everyone, for joining us. My name is Damian Gallagher, and I'm coming to you live from Emerald's 31st Annual Groundhog Day Investment Forum. With me, I've got Dr. Terry Smith, who is a director on our life sciences research team. He's been with Emerald for about 18 years now and does a lot on the research side and covering biotech companies. So if we could just kick things off, Terry, could you just tell us what makes the biotech industry interesting place for you to research and where you're finding opportunities there?
Sure. Thanks, Damien. So biotech is interesting for Emerald for two main reasons. Number one, there's a ton of innovation there. And number two, it's really inefficient. On the innovation side, about almost 20 years ago now, we sequenced the human genome. And from that, we gained insight into a lot of the genes that cause particular diseases. It's taken a while to translate that into what could be meaningful drugs for people. But over the last decade or so, we've had just a flood of drugs that matter a whole lot to patients. And when you understand the cause of a disease, it's a lot easier to rationally design a drug, and you have a higher probability of that drug being a good drug. On the inefficient side, it's a really neat space for Emerald because as I talk to my mutual fund counterparts, they are like, oh, I cover financials and biotech. Biotech is a magical black box to most investors because most of these companies have no revenue, so we can't screen for them by our traditional methods. The valuation metrics don't make sense because there's no EBITDA, there's no earnings. It's all about understanding the science. And it's in that complexity that a person like me that really likes to dig into the science can thrive.
Thank you. So sounds like there's a lot of opportunity in the space. Sounds like might be a lot of noise to sift through, but how are you finding stock ideas? What are you looking at, and where are you finding the best ideas?
So my job is really cool because I get to live the science. I subscribe to medical journals. I listen to a lot of key opinion leaders speak on various diseases. I attend patient conferences where they're just talking about the disease. I'm in social media groups, learning from patients what the problem with their disease is and what attributes of a drug would make it have really good uptake. I go to medical meetings. So it's really living in the weeds, understanding the science. And that's really the only way to understand these biotech companies. It's knowing what is going on with this disease, what have been the past approaches to try to fix this disease, and how this drug that is being developed might be better than the past efforts.
All right, great. Thanks. I think we've got time for one more quick question before we have to get back in there. But just looking at 2023, I think we've seen a lot of new companies come out over the past couple of years. What do you anticipate in terms of M&A activity, and where do you see that going in 2024, maybe beyond?
So 2023 was a very good year for M&A. The bankers might not tell you that it was because the absolute number of dollars of M&A transactions wasn't a record. You would have things like back in 2019, I think it was, when Bristol Myers bought Celgene. That added $80 billion to the total for the year. But last year was $170 or $180 billion. And the really nice thing for investors like us is that 23 of them were companies in the $5 to $10 billion range. That was the takeout price. That's the neighborhood we live in. And the neighborhood we live in is developing a lot of innovative drugs. So we're seeing innovative drugs that have good data is being acquired by pharma. Pharma has a pretty big patent cliff coming up to a third of their sales by the end of this decade are subject to generic competition. So they're looking to refill their pipelines. And we've had a couple years of digestion here. There's some really big innovations being put forward, and companies with good data are almost always being bought. If they're not acquired by pharma, they do generate really nice returns as a standalone company because you can make a real business out of a lot of these drugs.
All right, great. Well, I think that's all the time we've got for right now. So thanks for taking some time out of the day, and I'll let you get back to Groundhog Day, and stay tuned for more interviews. Thanks.